Hi guys, this is Dr. Bhupesh once again doing this authentic reading from original OET site and E2 languages. Thanks to both institutes for preparing this wonderful question papers. So doing question number 9. So we have done question number 7th and 8th, have done recording for the same. Now doing this question number 9. The case study of 67-year-old man is given to show that. So there is a case study of 67-old man, and why is it given? Simple. Why is it given? Why? Take it simple. Why is it given? So I will read the whole paragraph and then we'll decide why it is given. Because there can be, we have to do question number 10th as well. So I will take both the questions together. One of the three types of asbestos related disease is asbestosis. So there are three types of asbestos related disease. One is asbestosis, a process of lungs tissue scarring. So there is a scarring means a kind of fibrous formation in the lungs caused by the asbestos fibers. The symptoms of asbestosis usually include slowly progressing shortness of breath, cough. Any lung disease will have shortness of breath and cough, so it is common. Anything that's going to hit lungs is going to have cough and breath. Often 20 to 40 years after the exposure. Oh, that is different. That the symptoms are going to progress after 20 to 40 years. That is something different with this asbestos. That symptoms are happening very late. Normally, you will have an acute exposure, acute disease, but this disease is something different. Breathlessness advances throughout the disease even without further asbestos. So if you change your home, like in there, they were saying in the paragraph 1, after 1975, asbestos has not been used, should no longer contain. So even if you had been exposed to asbestos in the past, even without further asbestos inhalation, you will still have problems. Now, nothing from this it has my answer, because my question was again this. That is where you start giving your energy. So give your energy when your keywords are given. So I'm taking the keywords again. This fact is highlighted in case of 67-year-old retired plumber. He was on Ramipril to treat his hypertension and developed a persistent dry cough. So there was a dry cough persistent. He was on Ramipril for hypertension, which his doctor presumed to be an AC inhibitor induced cough. So maybe because of the medication side effect, the cough was happening. The Ramipril was changed to losartan. So they thought that let's change the medication. The patient never smoked, did not have a history of asthma or CPD, so he did not have any history, family history, personal history, but his cough worsened. So his cough went on worsening. He complained of breathlessness on exertion. In view of this history, the fact that he was a non-smoker, he was referred to a chest X-ray and to a local respiratory physician. His doctor was surprised. So he was shocked. Doctor was shocked to learn that patient had asbestosis diagnosed by a high resolution CT scan. So it's by the CT scan, doctor came to know that he is having asbestosis. The patient then began legal proceedings, because in foreign countries, if you have anything wrong from your employer, you sue them. So legal proceedings were done, as he worked in 25 years previously, during which time he was exposed to asbestosis. So obviously now I can understand the story. Always make the story first. So there is a 67-year-old man having cough, breathlessness, was taking Ramipril, but then it was changed to losartan. Then X-ray was done. In CT scan, he was found with asbestosis. Then he sued the company. So that's pretty simple. So let's see what is the topic and why are they speaking about this. Now I will go to the question number 9 and let's see whether it is difficult or easy. Smoking is unrelated to the diagnosis of asbestosis, nothing like that. It's not the main story. They want to know why 67-year-old man is being discussed. Why this story is discussed, not for this thing. Doctor should be able to diagnose. No. The time from exposure to disease may cause. May is our favorite word. So it can be one of the answers. Otherwise, smoking is unrelated. This cannot be answered. This can be answered. B. Doctor should be able to diagnose asbestosis earlier, but doctor cannot diagnose asbestosis earlier because the disease itself happens after a long time. So it is eliminated. Doctor cannot diagnose the disease earlier. The time from the exposure to disease may cause delay. That was the thing, that there were no symptoms. So time from the exposure to the disease was very long. That is why doctor had delayed diagnosis. So this is the main thing. Patient must provide, must cannot be our answer. So in final exam, guys, this is something for you to learn. May has the bigger chances, must has the least chances. Patient must provide full employment history. No, they were just trying to say that asbestos happen after. I will read it again for you. I will not compel you to do that. Rather, I should read it for you. What is the main point of the story? What happened that 22 first, that is where it started. The symptoms usually include slow progressing 20 to 40 years. First line. Breathlessness advances throughout the disease. The fact is highlighted. He was remipill. The patient had never smoked. His cough worsened. In view of the history, the fact he was referred to chest X-ray. So basically, the only point they want to cover that disease happened after a very long time after the exposure. That is the only point I can take. Otherwise, there is nothing special. This question was not as easy. I won't say it was a very easy and a clear-cut question like seventh and eighth. It was little tricky, but again, May word is something that I counted. I can be wrong as well. I'm not sure about the answer, but this is where I take this. Like in seventh and eighth, I did not ask the answer because I don't think that was wrong. But this I think should be right because of wayward again. Otherwise, maximum this can be the option. But I don't think so. This can be. But so anyhow, question number 9. In exam, again, the main thing, not to waste time. Whether you do B, whether you do C, don't waste time. That is the only trick of doing OET. That's it. This question is hard. Don't keep on thinking about it. Just go forward. What makes a question hard or easy is the option given. So B and C both can be the answer, but C is a better option, I guess. And May word is also given. May word is favorite. And it should be your favorite as well in the final exam. In the third paragraph, the writer highlights the disagreement. Disagreement is that something writer did not agree with. So I have to find in third paragraph that writer is not agreeing with something. Let's see. Writer is not agreeing with something. Let's see what is that thing that writer is not agreeing. There are two major groups of asbestos fibers, A and C. Never read complete. Just read A and C. It will make your life 10 times easy. A and C. The A are much more likely to cause cancer and scarring. So A is dangerous. Simple. A dangerous. Either group of the fibers can cause disease of the lung. So either means both. Both can cause problem, but cancer can be caused by A. The risk of developing related lung cancer varies between the fiber types. Studies of the groups of the patient exposed to C fibers show only a moderate increase in the risk. If you are exposed to C fibers, there would be only moderate increase, whereas A is more dangerous, C is less dangerous because only word is given. Show only a moderate increase. On the other hand, exposure to A fibers or both types of fiber increases the risk of lung cancer twofolds. Exposure to A or both means A or A plus C. So C is not dangerous, but A or A plus C are dangerous. Both means A or C together. So it doesn't mean C is also dangerous. For the cancer, A is dangerous or A or C in combination. That is what they do. Although OSHA has a standard workplace exposure to asbestos, there is a debate. Now, this is my argument. So means you don't have to overread it. I just read it once. A is dangerous, C is less dangerous. That's it. Main line is this. OSHA has a standard for workplace exposure to asbestos. There is a debate over what constitutes a safe level of exposure. So the argument is of what is the safe level of exposure that we don't know whether 2.2 fibers is safe or not. So there is no guarantee of amount of exposure. Means what is the safe level of exposure? Whether somebody is exposed less, whether somebody is exposed more, nobody knows what is the safe level. That is the argument. So argument is about amount of exposure. Argument is about amount of exposure. So relative safety of two types, no. It is very clear that A is dangerous, C is not dangerous. So there is no disagreement about it. Everybody agrees A is dangerous, A plus C is dangerous. So there is no argument over it. It is a fact. It is true. But it again read the question. Question has the power. So question is about what is there to disagree. The impact of the types of the fibers, the results of the study, the degree of the contact with the asbestos fibers. Degree of the contact, if you understand, degree of the contact means amount of exposure. So they changed the word. Again, not easy, but yeah, elimination will do. The relative safety of two types of fibers, it cannot be the answer because there is no argument. The impact of the type of fibers on disability, again, there is no disagreement because both the fibers have impact. A is more dangerous. Again, A and B are almost the same. The result of the studies into the levels of risk fiber, let's see the results of the studies. Let's see the results of the studies. I think there will not be, because disagree line was only the amount of the fibers, the safe level. While some people believe there is a threshold phenomenon which requires a certain level of exposure, but there is no safe level. Again, degree of contact is the only thing. So seventh and eighth were much easy. Ninth and tenth, guys, only one person asked. But I would tell you, the person who asked me ninth and tenth question, see, guys, ninth and tenth were tricky. But again, if you will understand, then you cannot do any other option. Ninth was also direct. The time exposure made in may cause. So that was the only point. In this also, they are just talking about the degree of contact. That the disagreement is about what is the level of contact, what is the safety level, what is the amount of fiber that can cause harm. So that is the main topic. I will again, harmful word would also be given. See, there is a debate what constitutes a safe level of exposure. So whether it is good or not. Threshold, guys, threshold is a word I must tell you because normally I though have read it in childhood only, but threshold is a very good word that everybody should know. So I'm not taking this word for granted. Suppose if I pinch myself, so I will say that's okay. It does not hurt me. But if somebody pinches me very hard, then the person has crossed my threshold. Threshold is the power not to react. So threshold means a power where it is, in case of asbestos fiber, threshold means where it is safe. So if I talk about this paper, the flexibility or the threshold of this paper is very nice because it can bear anything. But this paper, if goes in wrong direction, then now I have broken the threshold. Threshold means a, a an amount which a person can tolerate, which a thing can tolerate. So if there is a plastic thing, if I'm trying to mold the plastic thing, if it does not break, that is threshold, that is elasticity. If it breaks, then that means the threshold has been closed. Threshold means the power to tolerate. So that is what threshold means. So the main topic, again, I will not take this question for granted. The main disagreement was about what is the safe level. While some people believe that it's a threshold phenomena, that there is a certain exposure for the disease. Others believe that there is no safe level, that even the mild level can cause disease. So the debate is that what is the safe level? Some people say it is a threshold phenomena. That means there is a certain amount of exposure, like 0.2 fibers. But other people say, no, there is no safe amount. Even this much asbestos is dangerous, just like cyanide. Even this much is dangerous. So there is no safe. That is what the debate is. While some believe it is a threshold phenomena, that means there is some kind of toleration. Others say no, it cannot be tolerated even at 0.1 level. So that is what is the debate. So degree of contact with the asbestos. So it was very, very molded question. 10th question was the most difficult question we have done. 7th and 8th, I am posting the videos. 9th and 10th also I am posting the videos. But 7th and 8th were very easy. 9th was okay. I won't say very difficult, but 10th question was something challenging. So again, only thing you have to do in 9th and 10th question, don't waste time. Even if you get 1 out of 2. So if you get 7th and 8th right, then 9th and 10th, 1 right, 3 out of 4, superb. Means you will reach 5 out of 8 very easily. Maybe you can score 6 out of 8. 3 out of 4 means 6 out of 8. 3 into 2 is equal to 6, 4 into 2 is equal to 8. If you're scoring 3 out of 4, that means you will score 6 out of 8. So you are in very safe zone. We have to score 5 out of 8. 5 out of 8, 5 out of 8, B part also 5. So 5 plus 5 plus 5, 15. You will be in the safe marks. Part B and C, if you can score 15, that is the best. A part, you have to score 17 or 18 at least. Again, please listen to videos, guys. Again, I'm trying my level best with my 11 years of experience. I can't dig deeper than this. Ninth and 10th questions were difficult. Even if I dig deeper, even if you are sitting in the exam, if you are trying too much, it will not take you anywhere. Ninth or 10th, get one question right. Make it simple. If you get both questions right, you will get more than 400, maybe 450. So again, this is Dr. Bhupesh from Dr. BKM Institute. Please try to follow all the instructions in the best possible way. Thank you.